This is Dr. Andrew Young over at St. John's, and this will be a very practical video. We're not talking about techniques or perioperative optimization. We're just talking about process and workflow on the day of your surgery at St. John's. So this will be relatively short. This is also a great video for you and your loved ones to watch, so both of you have a clear idea of process. We know how difficult it can be for a loved one to be waiting for a family member to have surgery, and so we want them to be informed of the process as well. So there are hundreds and hundreds of steps in the surgical episode of care, but we're going to break this down for the purposes of your loved ones and also to give you general chapters of care on the day of surgery. First is arrival at the hospital. The second is preoperative preparations. At this point, your loved one separates from you. We go to surgical process, post-operative recovery. Your loved ones come back into the picture, and then there's discharge. So 5 main processes as it relates to when you and your loved one will be together and have contact with each other. Let's first talk about arriving to St. John's Medical Center. So the team will call you the day before surgery to give you your check-in time. The anesthesiologist will also contact you the day before surgery to review your medical history. We need you to be at registration 2.5 hours prior to surgery. It's not there to make you wait. It's because many things need to be done so that surgery proceeds smoothly. On that morning, do not drive yourself. Your loved one will drive you. You will go up to the valet. Gilberto and Roberto and the team will meet you there. You'll give them your card. You'll go to the front desk. Security will check you in. They'll send you the elevators. You go up to the 2nd floor, and then you go into registration. And then Latrice and the team will register you and bring you back to the preoperative preparation area. The reason we have you come in 2.5 hours early because there are so many things that need to be done. This is not like going to the airport where we just have you wait around for your flight. We have you come in 2.5 hours early because 2.5 hours worth of work needs to be done prior to surgery so that surgery moves smoothly. Visit with the surgical team, discussion with the anesthesiologist, medical history review, medication reconciliation, surgical consent, putting in an IV, compression stocking, shaving, infection precautions. There is a number of things that need to be done prior to surgery so that it goes smoothly. Your loved one can actually be with you for a time during this period. Once we are well along our way with preparations, we will ask your loved one to leave, and then we will bring you back to the surgical suite. We will bring you into surgery, and then many things happen in the surgery, but the first thing that happens is preparation. So the anesthesiologist will be working with you to make sure that you are comfortable and sedated, and then the nurses will be working with you for positioning, padding, and draping. It usually takes about an hour for this type of preparation. So please let your family know not to be concerned because it takes time to prepare for surgery in the operating room. Then there is surgical time, which can vary between 1 to 3 hours depending on the complexity of the surgery. Once we are done with surgery, once we are assured that the surgery is completed, everything has gone very well, and the patient is safe, I will then contact your loved one by phone to let them know that things are going well or to let them know if there are any concerns. Once I call, it will be approximately 2 to 3 hours before that family member is able to see the patient in the recovery room. The nurses will call with updates to let your loved one know when you can be seen. The next chapter is recovery. Once the surgery is completed, all the dressings have been applied, and you are medically stable, we will then transport you to the recovery room. The recovery room will focus on medical stability, monitoring vitals, pain control, neurovascular checks. Now, in recovery, one guest will be invited to the recovery room for a short period of time to say hello when you are awake and alert. Remember, this is just a short visit to say hello. We know how important it is for the loved one to make a connection with someone having surgery. This visit usually happens 1 to 3 hours after arriving in the recovery room, and the nurses will call with updates. Now, you will remain in the recovery room until the anesthetic is worn off and safety criteria have been met. The final chapter is discharge from St. John's. There are 2 different paths, and this all depends on age, biology, and the presence of pre-existing conditions. Some patients are candidates for going home the same day. That's called same-day discharge. This patient is discharged directly from the recovery room, and the nurses will call the loved one to pick you up. The other option, which is just as common, is patients staying overnight at the hospital. From the recovery room, the patient is brought to the orthopedic floor. That's the 3rd floor of the hospital, and guests are welcome to visit you there. So again, there are 5 broad chapters. You arrive at the hospital. You go to the preoperative preparations. And again, this takes about 2.5 hours. Then we go to the operating room. There's an hour of preparation time, and then there's surgery. We will call when surgery is done. Then you go to recovery to make sure that you're comfortable and stable. A loved one will be able to see you for a short visit in postoperative recovery once it's clear you're awake and alert. And then discharge, either going home the same day from the recovery room or going up to the orthopedic floor and being discharged from there the following day or so. There you have it, a short video of what to expect on the day of surgery. This is just process. This is actually a very important one for you and your loved one to watch together, so they have a very clear understanding of what you'll be going through, where you are in this process, and why they are waiting for you. Thank you.